Good morning. I will be talking about one-time low dose, that is 1% betadine wash to hasten recovery in viral conjunctivitis. I have been nothing short of amazed when I use this treatment, says Dr. Ernie Bowling. But this comes with a word of caution. Because a topical anesthetic must be used, it should be an office procedure only. Conjunctivitis, viral conjunctivitis accounts for nearly 7 lakh annual visits in the eye department, 92% of which are attributed to adenovirus. It lasts for about 1 to 2 weeks, follows a self-limiting course, and is highly infectious. The complications are pseudomembrane formation, SPKs, and chronic nummular keratitis. It presents as photophobia, blurred vision, eyelid swelling, ocular irritation, and chemosis. Focusing the spotlight on the star of the study, that is povidone iodine, it has a broad spectrum of action, high microbial kill rates, around 99.8%. It has action against wide range of microorganisms. It reduces the microbial load on the ocular surface and is used as the off-label management for adenoviral conjunctivitis. As of now, there is no FDA-approved treatment for adenoviral conjunctivitis or viral conjunctivitis. Our study dates back to 2023 in the month of July and August, when there was an epidemic of conjunctivitis in North India. We got about 100 to 150 patients each OPD for consecutive 2 weeks. We screened 1,506 patients and included 1,328 patients in our study. The inclusion criteria was patients presenting on day 1 and day 2 of conjunctivitis and having no ocular comorbidities. Each patient underwent, we had taken a swab for each patient and subjected it to gram stain and culture, automated identification and susceptibility by Vitek-2, and virological diagnosis was done. It was an adenovirus and an enterovirus conjunctivitis. As you can see the viral report, it was a co-infection. So we divided the patients in 2 groups. Group A received 1% betadine wash along with artificial tears, and Group B, which received the artificial tears only. There were 664 patients in each group. Pseudomembrane, if seen, were removed. The follow-up was done on day 3, 5, 7, 10, and 14. We followed it was an OPD procedure. We followed the no-touch technique, where the administrator wore the gloves and administered the diluted povidone iodine. We handed over tissue papers to the patients to dab off the excessive spillage, and they disposed of the tissue papers in the biomedical waste management bin. They sanitized their hands and left the OPD with the medication. The outcome measures were in terms of signs and symptoms, signs such as eyelid swelling, discharge, chemosis, conjunctival congestion, and symptoms such as blurred vision, eye itching, tearing, photophobia, and foreign body sensation. The results were as follows. Group A, that received the one-time betadine wash, nearly 73% patients showed complete recovery by day 3, whereas Group B patients, 1/3 recovered completely by day 7, the other 1/3 day 14, and the last 1/3 by day 10. There was no sequelae seen in Group A patients. However, Group B patients, 26% showed subconjunctival hemorrhage, 8% showed SPKs, and 36% had burning and dry eye symptoms. So you can see the remarkable difference between the day 1 and day 3 picture of Group A patients and the complications seen in the Group B patients, like subconjunctival hemorrhage and SPKs. So to conclude, 1% one-time betadine administration in the OPD is safe and relatively tolerable. It is in fact better tolerated and non-inferior to 5% betadine, and it reduces the severity and longevity of symptoms. These are the relevant references, but they have glorified the use of 5% betadine. Our study shows that 1% betadine has superior or in fact comparable results. So with beautiful eyes of Ma Durga, I would pay a tribute to the AIOS Kolkata and end the presentation. Thank you.
Whether you found that there is a SPK. This SPK was as a result of betadine use, or it can be due to viral keratoconjunctivitis itself?
Sir, it was due to the viral keratoconjunctivitis. In fact, none of the patients manifested SPKs, those who were administered the betadine washes. So, betadine basically acts in the extracellular phase of the life cycle of the virus, and it inhibits the viral neuraminidase and hemagglutinin and prevents the life cycle. It stops the life cycle. So that is why we had a reason to include the patients on day 1 and day 2, that is the extracellular phase of the virus. And none of our patients showed SPKs and subconjunctival hemorrhages.
Yeah, good study, it has excellent recovery.
So,
Betadine is known as antibacterial. Can it be also there that betadine wash must have removed much load of virus also?
The main idea was excluding the viral load. It also has an anti-inflammatory action on the conjunctival tissue also, sir.
Yes.
So it reduces the host response also. That kind of avoids the symptoms like subconjunctival hemorrhage and SPKs.
Yeah, good study. So in future we can start using 1% betadine Y wash. This was not known to us during that epidemic, so it can give good results.
Also, sir, the merits are that none of these studies had this large sample size, as was 1500, whereas these studies had 16, 20 or 200 sample size. But the demerits were that we did not use the viral load. We could have used the viral load to make the study more strong to indicate complete recovery.
Oh, quick question there. So is there any comparative data available between 5% and 1%? As you said, I mean, 5% studies with 5% are available, but like to say that, okay, 1% is superior to 5%.
I have only conducted the study. This is the first study of its kind, and in fact, now I'm also comparing 1% to 0.1% betadine, because the reason is that betadine on dilution, the free iodine available to kill the virus is available, whereas povidone releases the iodine gradually, and betadine is the only antiseptic that inactivates the virus, that is adenovirus, in 1 minute of contact.
Okay, so we look forward to that study results in the next AIOC then. Okay, thank you.